Hello and welcome. And today I'm very pleased to introduce Marian Nicholson. Hello, Marian.
Good afternoon.
So Marian is a director at the Herpes Viruses Association and the Shingles Support Society. And I came across Marian's organisation and I suddenly thought, gosh, we all think we know about herpes, but do we know about it? Other than the stigmas that are often attached to it. And so anyway, I investigated further and I listened to a podcast. I think it was a podcast, Marianne, wasn't it, of you talking about your story. And I just thought, God, that would be really fascinating to hear about. But before we go into Marianne's story, I think it may be more powerful to actually discuss so that we all know really what is herpes and what does it mean to have herpes?
Herpes is the family name for 9 different viruses. There is herpes simplex, which is what we're going to be talking about today, which comes as type 1 or type 2. Then there's herpes varicella and herpes zoster. That's type 3, and we know it better as shingles or chickenpox. And then there are glandular fevers and other herpes viruses, so 9 totally different conditions under the name. Herpes simplex is known as cold sores when it's on the face. We could call it a cold sore when it's on the genitals, but doctors tend to like to differentiate by saying herpes when it's on the genitals and cold sores when it's on the face. But of course, although there are 2 types, either type could be caught on the face or the genitals, depending on what the other person has whom you're catching it from, and depending what they're doing at the time. So of course, type 1, although it's commonly associated with the face, is in fact one of the most common causes these days of genital infection due to oral sex. Doesn't much matter which you have. People worry hugely when they have it on the genitals, which is ridiculous because medically it could be more serious on the face, since it could choose to recur in one eye, and then you really do need the antiviral treatment. Otherwise, it could be damaging to eyesight. But genitally, it doesn't do anything at all unless somebody happens to catch it just when she's 3 months away from giving birth. That's the only time that it's medically a serious problem when you have it genitally.
Right.
There's lots of treatment for it if people have the bad luck to be getting a lot of recurrences. So people don't have to have recurrences these days. Before the invention of antiviral therapy, of course, the story was different.
So do you want to, I'm interested that actually it's all related to chickenpox, and I have no idea about those sort of things.
That's why we're called the Herpes Viruses Association and Shingles Support Society, because herpes viruses strictly does relate to all 9 human herpes viruses, but we have to add Shingles Support Society because otherwise no one knows, because no one ever dreams that they are related so closely. The same antivirals that you use to treat cold sores on the face or on the genitals is indeed the treatment that you get for your shingles.
So before we talk about how we manage herpes, would you like to share with us your own story?
I caught it in my early 30s. I was I'd not really heard of it because back then it hadn't really started to be stigmatized or talked about in the same way. So I wasn't particularly bothered at first. And then my sister, who lived in America, sent me an American magazine. That's the equivalent of Googling it these days and coming across American websites. And I read this American magazine, which basically told me that it was a total social disaster and you could expect never to have sex again. And basically, I just sort of felt, oh, that's it. My life is now on hold for the rest of my life. Luckily, I had a really interesting job at the time, which didn't really offer me time to get into a relationship or anything. So I just concentrated on the job for the next 2 years. Now, it was while I was working, I overheard on the radio, Capital Radio was going on in the studio where I was working. The ladies who set up the Herpes Viruses Association, they were discussing herpes on the radio and their charity. So I quickly grabbed a pencil and scribbled down the contact telephone number in those days, and phoned them once the job was finished and I now had time to explore. And learning about it totally turned my head around. Not immediately. The first time I heard that, of course, we're having normal sex from the people I met at the tea parties, I thought, what rubbish, how can anyone say that? Of course you can't. And then I went to another tea party. Again, no internet, no forums. And again, I heard people talking about their perfectly ordinary love life. And suddenly it went click in my brain. Hang on, I'm imagining I can't have a sex life. And these people are having sex lives. Who is a more reliable witness here? And I realized that I needed to change my ideas because they were having sex lives, so why shouldn't I? And then now I've been working here at the Herpes Viruses Association, and it's marvelous because by giving people good information and explaining why the stigma is just really an advertising campaign, it has no basis in fact whatsoever. It's not linked with the severity of the condition, or even particularly about what general population thinks about it. And therefore, telling people about this so that they can also have this moment of realizing that it's actually all fine is really lovely. It's a great job.
So when you discovered what are the main symptoms of herpes? When do you say, oh gosh, that's not normal?
When you first catch it, it will start off usually with great discomfort in the genital region, which you might just think is a bad case of thrush. But then the real telltale signs are when you get that blister. Cold sores, as we know, want to make blisters. And if they're down below, they do the same thing. They make a blister. And at that point, you have to go along and get yourself swabbed at a sexual health clinic. GPs often don't have the equipment to diagnose you. They will just make a best guess. And a frightening number of people are told it's thrush when actually it's herpes simplex by the GP. So you go along to the clinic, well, and take a swab from the sore place, and they will then tell you whether that has got herpes simplex virus in it or not. And nowadays, they will usually tell you whether it's type 1 or type 2, which is useful to know because type 1 really doesn't, although it's very commonly caught down below, it really doesn't much like that particular site. And therefore, people with type 1 get something like 6 times fewer recurrences than people with type 2. All the herpes viruses have this thing in common. Once you've caught them, they could reappear at any time in your future life. Once you've had chickenpox, at any point down the line, you could get shingles. My nephew had it at 13, my niece at 35. So I've had it, but only just recently. It tends to be in older people. With herpes simplex, you get sores coming back in the place where you caught it. So if you caught it facially, you could only get a sore coming back on your face. If you caught it down below on the genital region, it can only come back on the genital or anal area. And
so once you've got it, and do you have to be diagnosed officially with it to know you've got it, or?
Well, to know that that's what it is, yes, indeed you do, because there are 28 other things that can make a blister-like condition on your genital region. So if a doctor is looking at your genital region, they have 28 other possibilities running through their head. But it's a bit like if you hear a hoofbeat, think horses, not zebras. It's a bit the same, you know. For instance, only 3% of what looks like herpes simplex is actually shingles in the genital region.
Right. So once you've caught it, it's uncomfortable, it's not nice. How do you go about treating it? Are there various ways to treat it, or?
A first infection that's bad enough for you to really notice and go and get diagnosis will be treated with antiviral pills. So you take the antiviral pills for 5 days, 7 days, and that will stop that first outbreak from continuing to go on. Without the pills, the first outbreak could last 2 weeks or so, just depending on your own genetic inheritance. Most people who catch it don't notice. It is so mild, they think it's a sore place, an itchy patch, a little cut, an infected hair follicle. So only 1 in 3 who catches it is going to have it badly enough to actually notice. Most people with herpes are running around undiagnosed.
And do you
Now,
know what the population is, you know, of, you know, is it 1 in 10 people have it, or?
by the age of 25, 7 out of 10 people have got herpes simplex. That breaks
Right.
down to 6 out of 10 with type 1. As I said, lots of type 1 is genital these days, and 1 in 10 who's got type 2, which is mostly genital. That goes up as you get older, from 7 out of 10 by the age of 25. We have data from Australia where it's basically well over 80% of the population has got the virus at the age of 35 plus. The more partners you have, the more chance there is you will have picked it up from someone. Research in London area found that on average, where you've had 7 partners in your life, you're more likely than not to have herpes simplex type 2. And I caught it from partner number 7 because I'm so perfectly statistically accurate.
So if you've got it, it's uncomfortable, get a diagnosis, and you can have antibiotics.
Antiviral drugs.
Antiviral drugs.
The virus,
sorry.
not a bacteria.
And it goes away. If you don't, I suppose the biggest thing is people think, well, as soon as I have sex and I've got I don't know if you express it as have a flare, you can pass it on. Is that the case?
That's right, absolutely.
Yeah.
We tell people, please, now that you know you've got it, you have become a safer partner because, as I said, twice as many people catch it without realizing. So now you know you've got it, you can be more considerate with your partners. The moment you feel the itchy tingle that tells you something is on its way, just like the advert for cold sore cream, when you feel that tingle, stop having sex. For different people, it will be, rather than a tingle, it'll be an itch or a stab or an ache or a pressure buildup under the skin like a volcano is about to erupt. You get to know what your symptoms feel like. And it's always pretty much in the same place. So again, it's somewhere, it tends to be somewhere where you're expecting it. But we can't tell you how many recurrences you are going to have. It is totally dependent on, firstly, your genetic inheritance, whether you've got the good genes or the bad genes. And secondly, on your lifestyle choices, because obviously stress, illness, tiredness are all things that are likely to trigger cold sores on the face or the genitals.
And why, I mean, does it matter if you pass it on? I know that sounds like a silly question, but, you know, people say, well, it doesn't really matter. I can pass it on. Somebody can go and get some drugs to help them and it's all fine.
Ideally, we should say just that. But quite frankly, it doesn't matter if you pass on a cold, but no one sneezes in someone else's face and thinks that's appropriate. We ask people to try not to pass on a cold. We ask people to try not to pass on a cold sore. But remember, most people are going to catch this virus off someone who is unaware that they have it. And therefore, those of us who know we have it immediately become safer individuals. We're less likely to pass it on. So we suggest to people that you be considerate, but don't be celibate. It needs enough virus to infect somebody. When you feel the beginning of the itchy tingle, there may not be enough virus actually to infect somebody, but it depends on their level of immunity. On a day when your partner is in right good health, it wouldn't infect them. On a different day, with exactly the same level of infectivity on your side, your partner could catch it because they've just come back from a wild weekend where they have run themselves ragged with booze and lack of sleep. And this time they do catch it with exactly the same amount of virus. So it can't be predicted in a hard and fast way.
So with your charity, what does your charity offer and why do people come to your charity?
Firstly, of course, from the medical conferences that I attend and so forth, so that we know what we're talking about. The internet is full of wild ideas. I do not know where they get them from. And American stories tend to be very different from the English stories. And therefore, we recommend that people get good English information. Then we can suggest treatments which are not medical. There are people who would rather not get pills from the doctor to control their occurrences. And we've done lots of trials on the herbal kind of things, which ordinary medical doctors are not interested in doing. So we can tell you which ones we've found are helpful and which ones are not. We can support emotionally because we've all been through it. So we understand the issues that might be a problem for you. And that way we can empathize with what you're going through and give you lots of practical advice, as well as ways of explaining it to people if you choose to explain to people. There is no requirement that you mention your herpes to a partner, which is just as well, because nobody would dream of thinking it's necessary to say, before I kiss you, I feel obliged to mention that I had a cold sore on my face 6 months ago. You know, they'd laugh their heads off if you tried to do that. So there's no requirement, but it can be a good idea, because if you're going to be occasionally having to say, oh, we can't have sex just at the moment, I'm not sure whether it's going to be an outbreak, but better not to do it. It's much easier if you've explained why.
And I suppose and understanding that, and how you're very open, obviously, about how you speak about it, is the way to go towards breaking down the stigma that always seems to be associated with it.
It's one way. And the other way, I'm asking doctors to stop using medical terminology. They will talk about an incurable disease, when actually what they mean is something for which we don't yet have a pill. So an incurable disease is flu and colds. We don't have a pill to stop colds and flu. Disease just means illness in a medical context. But of course, to human beings who aren't medics, those two words make it sound absolutely terrible. You know, we associate the word incurable with something that's going to kill you. This is utterly unimportant. It's on a level with a cold. Well, it is a cold sore. We don't have cures for practically every medical condition. There are, you know, most conditions are not curable. We're lucky that we have got some preventive vaccines to stop people getting flu, because that's not curable. And indeed, they're working on a vaccine to stop people catching herpes cold sores as well. But that's for the future. We have no idea when that might be available, but they're working on it.
Yeah, no, I mean, and would that be, I mean, I don't know if you would know, would that be something that you'd have an injection when you're a baby and then that would be it, or?
We don't know. We have no idea. I'm not going to even speculate what it might be like, because ideally, of course, that would be very convenient, just as we now have a vaccine to prevent you from having chickenpox. Measles when you're a child. The chickenpox vaccine is given to many children in other countries. We don't give it to English children yet, but it's certainly available. So yes, there are vaccines to prevent people catching things which are given as babies. I have no idea what's going to happen when it happens with the cold sore vaccine.
So what we'll do is, obviously, when we broadcast this out, we'll put some links to your website, and there people can find helpful information and also alternative therapies, I think you mentioned. Yes. Right, if you don't want to go to the doctor to take standard medication, you have alternatives, which I think many people would be very interested to find out about.
Yeah, absolutely. I highly recommend them. I'm using the cream myself. It has stopped 15 recurrences. 5 slipped through when I didn't have the cream to hand. So really good, really good.
Excellent. Well, Marian, really nice to meet you. And I'm sure this will be of real interest to many people.
Thank you so much. It's been fun chatting. Bye for now.
Bye.